What's the biggest lie you've found about recovery and performance?
I think the biggest lie that people think is that you don't need recovery. You can just do that old no pain, no gain mentality. You push through. You know, you kind of think that, the old days of like, no grit, no glory. Let's go for the good stuff. Let's push through. Oh, you feel tired. Well, you gotta, demand more from your body by just thinking through it. But people don't understand that as much as you compress, you stress your body out during a workout or some type of game event, you need that recovery to come back to 100%. If you don't get to 100%, then you're going to start at 90%. Then you know how that goes, one step forward, two steps back. So I think the biggest thing is that you have to really understand the difference between an injury pain and recovery pain. You got to make sure that you're not overtraining, you're not pushing yourself. So recovery is a big key ingredient. So when you hear people say, oh, you don't need to rest, you feel tired, sometimes it may be, but most of the time it's your body not being at 100%. So it's very dangerous when you start pushing yourself into that realm of overtraining. Now you're going into that world of changing biomechanics. Then it goes into the world of, chronic injury.
You spent some time working with the Tampa Bay Buccaneers, and I mean, in those locker rooms, athletes are pumping injections into them left, right, and centre just to get on the field, and never mind what they do then to stay on the field. But you walked away from that, creating something completely different. Why?
Any athlete that wants to get back into the field or practice your game. So the first thing you want to do is, learn a secret weapon. And the secret weapon is basically regenerative medicine or stem cell therapy. So the only way to deliver that is through an injection. Now, the tough thing about that is that people really don't understand what stem cell therapy and the mechanism of this whole regenerative medicine, how to make this tissue that doesn't heal correctly or slowly speed it up. They don't understand that. So once you understand that the secret is the message, right? The signals, now you see like, all right, now, how do I deliver it? So everybody gets it delivered through an injection. Well, when you're in the season, when you're doing like a stem cell therapy during the season, you have to inject the area that's damaged. Well, now you have a secondary site. So a lot of athletes don't do that during the season. They'll do it after the season or something else, that can give that the ability to recover for that period of time. So during the season, when you think about what they do for like injectable, it's more like pain med, like, like numb the area. You shut the area down so you're able to play without that pain. Well, the problem with that is that you didn't solve the problem. All you did was mask it. When you mask the pain, now you're basically re-injuring over and over again with that biofeedback of feeling that pain mechanism. So that's why, we look at that world of pain management and then masking versus going to the source. So that's why I started thinking if there's a better delivery system than an injectable to get these signals from stem cells to that damaged tissue to heal, that's the pattern. And that's how I found out the best pathway through that process.
Read a story about, you might know he plays in MLS now, Luis Suarez, and he has like ankle injuries for so long. I mean, he was a top flight footballer for so long. I mean, he's getting kicked every week in his ankles, getting stood on. Obviously, it adds up over time. But he was saying for like the last like 5, 6 years of his career, he needs injections to play the game. And the way that they've structured it is he's going to have to basically do whatever he can to ice and numb his ankles throughout the week so he can't train and pretty much can't play in the garden with his daughters. He can't. He says that he can't take his dog for a walk because if it goes too quick, he can't stop himself from going. And I always thought that while that's good that he can prolong his career and he's still playing at a good level with these injections on game day, it doesn't give him much of a life. Like I know people say like, oh, their small portion of their life is being an athlete, but you do have to think afterwards that pain isn't just going to miraculously go away. Was this maybe part of your theory of can we get them to be as normal as possible while managing these injuries so they don't have to like lock themselves away all week and then inject themselves on game day like they're coming out of a chamber?
So that's absolutely what I see through these athletes when they go into their retirement world. So you're absolutely right about that. So when I think about like when you think about regenerative medicine, you're not just talking about, getting ready for the, after your endurance or after your event and then recovering from that. You're also looking at the long term also. That's correct. So the big thing with that is that you're going to chew down some tissue. If it's cartilage, tendon, muscle, you're going to chew it down. And the ability to grow it back is difficult when you start traumatizing the area and it's repetitive. So you're doing something over and over again. You're just taking something and it's like an erosion of like the Grand Canyon here in America. You just start, water starts eroding away. If you don't replace that part of that soil that's eroding away, you're going to have that deep canyon. And then all of a sudden, when they retire, they're going to have that type of like, post surgical, maybe a replacement of that joint or something that's not, that's going to give them like a normal type of like, like a lifestyle. So yeah, you want to look at not just the short term recovery. You want to talk about long term recovery, and then regenerative medicine is basically what you're trying to do is regenerate your tissue back to normal. Normal is what meaning that you can move, that you can be able to do things.
NFL quarterback comes to you. He's got a career-threatening grade 3 Achilles tendonitis. Season's close. He knows he wants to play. He knows his only option at the minute is stem cells, but it's going to put him out for weeks, so he might get back for playoffs. What's going through your mind straight away? Because you noticed something that other people didn't.
I know that that particular stem cell therapy works. I know it, and it helps him. But the problem is that the injectable is going to give him that delayed sense of being on the field and maybe delay his whole world of like career. Because think about it. When you start identifying an Achilles tendon and you report it to the team, well, the team says, okay, mark it down. He's prone to Achilles tendonitis. So then when you go into negotiation, because you're last year, now they use that as a negotiation tool. It goes, hey, you're worth this much, but you're not because of this or that, right? Achilles tendonitis will come up in the conversation. So he was concerned about that. So I would definitely, look at that side of it and say, hey, there is something better. It's just the delivery mechanism is wrong. The needle is wrong. If we can get into a topical world, and that's why I developed that topical stem cell cream. So with that, it's the more important thing is that now I can give it to him. So the great thing about that is that there's no downtime. He's able to continue on play, but he has the signal that's giving him the information down his tissue, the Achilles tendon, to grow, to do its job. And with that, he's able to prolong his season. Now he's not reporting the injury. And the more important thing is healing. That's the big thing. It healed during the process of moving. Lastly, he negotiated his contract. So everything worked out.
I know for a fact when he came to you, he was thinking, get me on this field as soon as possible, because he knows whatever happens this season, I can bounce back from an injury. It'll play into those negotiations. He's not looking down the line. But how do you get someone to look long term in that regard, especially when they probably haven't heard too much about your cream? So how do you shift their mindset? Because I know he's thinking now, how can I get back on the field?
Yeah. I think the big thing with athletes is that they know, especially like when it comes to the later athletes, like when they're on a third or second contract. When you look at a rookie contract, they're like us, right? When we were teenagers, we're like invincible. We could do anything. And I don't need that recovery rehab. But once you start really beating yourself up and you realize, wait a minute, I'm not recovering as fast as when I was like 17, 18 years old, that's where it plays into it. That's where they start saying, oh, geez, I better start taking care of my body. I need to start looking at everything from nutrition to, anything that can help me regenerate and get myself back to normal. I want that. So then it expands out to where I can do it from after the season, after the career, after this. And then they start recognizing, hey, I need to start taking care of myself. And the neat thing about being with athletes is they're at the high performance and they really push themselves to the biggest type of aggressive type of event to their body. So then what, like weekend warriors or just everyday people recognize is if it works for that guy that's in there beating himself out, it's going to work for me. So it translates so well when I talk to these other patients that have like classic things like, like arthritis in their knee or the hip. And they're saying, hey, what can I do to prevent maybe like a possible knee replacement or some type of surgery? Well, then we talk about regenerative medicine. You just have to grow that tissue back. And they'll give me, that statement like, well, what is it about? And then we'll go through that learning process to learn about what this whole mechanism of stem cells is all about.
Yeah. I can understand your point of view as well. I honestly, whenever I've done some research into what you've created, it's absolutely amazing. It's mind blowing too. But I'm thinking from the perspective of the person that doesn't believe that, like they believe that there's an instant fix now and that's the way to go and this cream's not going to happen, it's not going to happen long term, things like that. So we know stem cells it's needles, it's live cells, it's injections, things like that, and it's almost like people are feeling more confident on it because they can see exactly what's being pumped into their body. But you use this cream that's it's more bioactive more than anything, and it's like, with creams, people, even like those like heat rubs and stuff, people don't really know if they're going to work or not. They just do it anyway because someone said it does. So if I was a 12-year-old sitting here, how would you explain the difference and the benefits from your side?
Okay, so let's take maybe like two steps backwards and just talk about stem cells, right? Let's talk about this thing that people, when you look at like the word stem cells, they know that it does something. It helps you feel youthful, get you back to normal, grows tissue. But the mechanism is the confusion, right? So people think that we need these live cells, right? These live cells. So when you hear about the word live cells, I got 10 million live cells injected in me when I went to this clinic or some, country or somewhere, and I got these cells. When you hear about the word live cells, you're looking at a cell that has a nucleus. A nucleus has DNA, chromosomes, and genetic material that's going to do something. Now, the dangerous thing is that when you put it in your body, you don't know what that's going to turn into, right? Now, the old days, they used to say like, these stem cell called mesenchymal stem cell would like differentiate, meaning that it'll turn into your cell, right? It turns into a tendon, ligament, and just knows. Well, then you ask, how does it know? It goes, well, it just knows. So then you have to ask this next question. Well, if your clinician doesn't know what's really going on, they use terminology like that, then you have to take the next step back and do your own research. What I see is that live cells has its strengths and weaknesses, meaning that its strengths are going to be it's going to give out signals. That's what you want. The signal is what we're trying to achieve. These things called EVs, extracellular vesicles, they have information in the form of like protein, cytokine, enzyme, information that we want to target our existing tissue to do its job. Because if you look at the other side, a live cell that's going to turn into somehow your tendon, well, then you have to have the same chromosome, the same DNA, right? The same messages, the same kind of like ATCGs that's going to be in the billion mark, and it's going to do the same exact code on your existing tissue. Impossible. So that's why signal is more important. When you understand signal, now you're seeing like, okay, I don't need the live cells. I just need what it's secreting, right? That information. That's what's important. So when you get that information, a signal that's bright and strong, and then you give it to your body, it's going to go target that damaged tissue and tell the damaged tissue to do its job by signaling to do your job. So that's what this topical stem cell is all about. It's not about the live cell. It's the information, the messages. That's why you hear these buzzwords now coming out, the stem cells, of course, and then you're hearing things like exosomes, peptides, these things. Well, that's message. That's just basically a cell-free bioactive biologicals, right? So you're looking at those things, information to tell your existing tissue, because our cells right now are sitting dormant, waiting. It needs this information. Because we have that kind of information right now. We heard of like things called the endocrine system, where we have these hormones secrete from the brain and targets like an organ. Well, it's the same kind of like message, except for it's a longer path. When you look at these little stem cells, right, and they secrete these little EVs, these messages, now they're coming into a form of like they call it the paracrine system. The paracrine is basically signaling cell to cell, right? So that's what you want. You want cell to cell, right? Not so much live cell, but just an encapsulated type of message to our existing tissue. So that's the difference, and that's why it's going to hear more about this signaling. That's what's really important. When you hear about that, you're going to see the future move towards that kind of terminology, and that's a fantastic thing because it's a smaller molecule. Smaller molecule now I can take it into a topical application with a transdermal agent. And the best thing about it, it's cell-free, meaning there's no nucleus. And when you have no nucleus, there's no form of tumor formation. That's what's really important.
You mentioned peptides, and I don't actually know too much about them, to be honest, before this year, because I know there's a lot of fitness people that are using them and stuff, and I know I've heard athletes using them too, but what's the deal with them? Because they're always something that I always feel like if you don't get in your face scientific backing on these things, long term they can't always have that many benefits. How do you feel about peptides?
There's research coming up, and there's some theories, and there's some research that backs that up. All of this is basically just long chains of proteins. It's all of this, and it basically just helps you along. So there's the one that everybody hears about are like BPC 157. So there are these type of like peptides in our intestine lines that they determine that our intestines have to recycle. So they've taken this type of like this chain of like proteins, and then what they're doing is they're replicating with the synthetic production of that thing, and then you can inject it into a tissue, and then it will signal your tissue to do its job in that format. So there are some merit to it. The problem is long term. You don't know what's going on because if it's meant for one part of the body and you're trying to like synthetically make it and then you're putting it to another part of your body, now you may have something that, long term may affect you. So there is some merit to it again. But then, you hear about these cases like, I did an injection and right away I felt no pain. And you have to ask yourself, it can't work that fast. So then you're looking at, well, what happened here? So when I hear about like injecting like a joint, like a knee joint or an ankle joint, and you have, let's say, you have arthritis. Well, arthritis is when you start chewing away or destroying some of your cartilage, and you start losing your joint space. When you start decreasing your joint space, now you're kind of touching a bone or something else that you should be able to move because you have more space. Now you're getting close to the actual bone on bone. So that's why you probably have pain, right? That's the first sign that you're starting to deteriorate. But if you inject something into that joint, if it's a fluid, if it's a peptide, it's going to increase that volume of fluid in there. Well, guess what? It's going to increase that joint space because you just added more fluid. And all of a sudden they say, "Hey, I feel better right now." Well, is it because that particular injectable that you put in there did that fast of a turnaround, or was it because you increased the volume of that they call it synovial fluid? You increase that fluid in there so you can increase that joint space. So that's why you have to look at it like it doesn't act that fast. It doesn't work that fast. So I always look at it. Maybe it's that increase of volume that you put into that joint that makes it feel better.
So the end part of this episode is going to be a bit of myth busting. But before we get there, I can't leave this episode without talking about this story because it hooked me all week, honestly. But you worked with Olympic sprinter Walter Dix, and I mean, he was almost destined to just be the biggest what if in athletics. Like, it was almost like, oh, career cut short because of this, because of this. But you somehow managed to transform him. And I just want to ask you to talk us through who Walter Dix is first and what the hell did you do to that man?
Well, Walter Dix, right? So he was at school here at FSU, Florida State University, and he was a phenom there. So in college, he was a dominant force in the 100 meter, 200 meter, and of course the 4x1, if you guys know track. Great talent, great like work ethics. But the problem with sprinters, and especially with him, is he's so strong and so fast, he was prone to hamstring injuries. So because of that, he could never push himself to 100%. But he was still a winner. I mean, he'll still be NCAA or college collegiate athlete, winner in that event. So once he got into his senior year, he went to the Olympics in 2008, I believe, and he did well. He got bronze medal in the 100, 200, but he was always prone to his hamstring injury. So after he graduated, he from Florida State, and he came down to Tampa, Florida, where I was at. It was me being the medical side of it, the medical and the therapy side, and then the other person, the coach, was Coach Rhee Robinson. So the two of us would work together. When we worked together, it was him basically working on his technique and driving hard. And then the hamstring issue was my responsibility, is to keep him like 100% and understanding what he's dealing with. So because of his biomechanics and the way he was moving, we had to break things down and find out his weaknesses and his strength, and then really hone into his weaknesses to get stronger. So with his hamstrings is a concern, and it was my job. And then that was based on all kinds of therapy we did, special attention, and understanding his recovery. Understanding when he pushes, he needs to get back to see me so I can get his tension and his tissue correct. So because of that, that was 2010 when he came to my office and we worked with him. So we were just trying to, the first month or two, you have to find the person's anatomy and the way he moves and the communication that we have, back and forth, because it's a team event, right? So you think about, he's an individual playing an individual sport, but in his supporting group, it's a team. There's a coach and there's myself, and then we all have to connect and then be as one. So it took a little period of time to get that. Then 2011 comes around. 2011 comes around, we get him going. His hamstring is strong, and he's able to do excellent things. He's traveling around Europe and then winning competition. There's a championship called the Diamond League. He's dominating that in the 100, 200. he wins that. He goes into the world championship and he gets 2 silver medals. He's on progress to at the 2012 Olympics to dominate. Usain Bolt's there during that time. There are times that we would match up with Usain Bolt because at the beginning of the season, it's not about like, racing. It's about just tuning your body up to the end of the season for those world championship or the big events. So Walter was trying to chase him around the country, but then Usain would like kind of like hide away because Usain was really about prepping up where Walter wanted to get experience because you want to have a lot of face time with someone. So when you go to the competition level of that championship, you want to be at your best peak, but be familiar with that peak. So once we got to that level of the world championship, it's about getting close to that environment in the warm up track, so then we can introduce that tension before the actual event. So it was a lot of face off time and seeing each other before the race, and a lot of interesting things about that. I'll go into it later. But the neat thing about that is he did well. He really excelled to where he needed to be, and then we were ready for the 2012 Olympics. Well, because of the 2011 events doing so well, his sponsorship, Nike, decided, hey, I want you to do this type of training in Los Angeles, not Florida. And then, for him to get enticed to go there, that way they probably they did a little bit of more bonus money, maybe renegotiate his contract, get more money, and gave him the face of it. So because of that, you're going to say yes. So he decided to leave us, go with another group. The problem is that they don't know him and his hamstring issue. So 2012 comes around, Olympic year. They're pretty much theming the whole race about him. The USA track and field is all about Walter Dix. Well, of course, his hamstring comes up. When a hamstring comes up, nobody knows how to handle it. Nobody knows the real, like the mechanism, get him back to normal. So that year destroyed him. So because of that and that place where he trained, it took on a life of its own. It basically, when you start getting a physical problem and you have it for a long period of time, it becomes a mental issue. When you get the mental issue, now you're looking at, what is going on with me? You need some type of like maybe I don't know, some other therapist involved. So when you get involved with that physical that goes into the mental side of it, it's hard to come out of it. It's really difficult. And that's probably the biggest thing that happened to him was just that movement of the team that we had here in Tampa to the team in, LA. That was, I just wish that we had discussions so many times about, stay here, understand what you have. We're targeted to the gold medal. We're going to do great. Sometimes when Nike calls and you get enticed by money and, TV deals and all that, you got to go. So, that's one thing that if you just look back, just had a little more time, just stay 1 year here. Oh, he would have been that one guy that beat Usain Bolt.
I was just about to ask that. Like, if he had stayed, even if it was just 1 year, we'll not say long term, because again, you mean Nike's going to come knocking again at some point if it wasn't that year. But what do you think he could have done? Because he is a name that you would probably only know him if you were a deep fan of athletics and the Olympic sports. Like, I mean, you look at those other people like Blake or Tyson or the guy that did run for USA Gay and Usain Bolt, their names that they transpire thing. Could you think that he could have hit that mark? Could he have been that one of those all-time greats?
Oh, absolutely. Now, remember during that time, there were people even in the let's say USA and who else had problems? So they were popping up, positive with PEDs. So, performance enhancement drugs. So Walter wasn't that guy. Walter was straight on talent. He didn't need any cheating. I would sit there and just hear the stories about how people, especially sprinters, you can't, you hear the Balco and you hear these stories about these athletes and you can just see them. You can see them when they're in the meet and then you see them like 2 weeks later in the meet and they've changed their bodies in a tremendous way. He goes, okay, I see what's going on. So he's cutting down, he bulked up. So we know what's going on. But Walter it was always the same weight, always the same thing. And that was, so for being clean, knowing that, and then competing, and then the potential he had, oh, he would have been that person in America. It would have been no doubt about that, man. I always said that there's a reason why when we were traveling around looking for that race, he wouldn't show, Usain Bolt wouldn't show up that race because he knew that, that he wasn't ready to run that race. He didn't, he didn't feel that peak season. So yeah, he would have been that guy.
Big topic at the minute is morning routines. Fortunately, all these influencer morning routines are 4 hours long and they haven't got call times at 2 o'clock in the day, so they can afford to have that time. But there's no real quick, easy setup for the day morning routine. And I want to start that with you because anybody that goes to this guy's website will see the people he's worked with, and he's a bit of a genius in these performance things. Like, we're talking about some of these people shortly, but it's a bit in seeing what he's done. So let's say first 60 seconds after waking up, what's the do's and don'ts?
I'll just talk about what works for me, right? So what I do is I meditate. I just need to set myself in my mindset of just neutralize things. And then after that minute of meditation, then I start going into some type of positive reinforcement, some positive affirmation or positive, that could be a form of a YouTube video. You want to start your day with positive. Then you can go into the physical side of it, warming up your joints if you need that, right? So my thing is that you have to get the mind right. You have to put yourself in the right environment mentally. So when I hear about these things that you're talking about, these workouts that last for a long period of time, and you're starting off, I guarantee a lot of people are going to fail that. You're not going to be succeeding that because you're asking yourself to do a huge behavior change that's going to be too detrimental to just your whole day and week and everything. So it's tough. I always look at everything that you want to change something in a type of microdosing, right? You want to start slow. You want to just have a little bit of victories. You don't want to have that. I'm going to be dedicated. I'm going to get up 3 in the morning. I'm going to work out that 90 minutes, and I don't care what it is. It may work your first week, but I guarantee it's not going to hold. It's not. It's going to be one variable, and he says, "Oh, I can't do it because the car didn't start." And then all of a sudden, you just quit because of that, and then it just basically just shuts everything down. So I always think start small. Start small where it's easier. You start off like at a time of your normal wake up. Let's say it's at 7 in the morning. Well, 7 in the morning is a good time to start a workout. Just do the process. What I usually do is mental, get your mind right. And then you can do a little exercise by doing something that's simple, something that's very simple, that's easy. And then maybe it could be just a simple like 10 squats, maybe 5 push-ups, and that's it. And then start that week and then start adding on, and then it becomes a behavior. Now you're craving that period of time. And then you can just, if you really want to get it before your workout, then you can slowly start stepping back from 7 o'clock to 6:50, 6:45, just slowly going back. To shock your body like that is going to be so difficult, and that's just not just your behavior throughout the workout. Think about in the day that you're working, your day's off, you're tired, you can't focus correctly because your day's set off too fast, too hard. So I always say start slow. Start very slow and work your way up to what you want. And then don't ever think I want to be here in 30 days, 60 days. You've got to think long game, long play. I want to be here in 2 years. It's so much easier manageable because nobody's going to be 100% perfect. I can't do that. Nobody can do that. Not even athletes can do it. I'm going to work out every single day, every other day. I can't do that for that period of time because you're going to have one failure. Something's going to happen, but it's okay. No big deal. I've got a lot of catch up time. Start again the next day. Whereas if you have 30 days and you miss one day, it goes, oh shoot, I just lost a day. That's a 30th, right? I'm screwed. Let's quit now. We tried our best. No. So that's why I always say micro dosing them, micro victories.
Yeah. I've gotten pretty big on a little bit of meditation or breath work for 60 seconds because, this is proof that I'm learning with the show as well. I've had so many guys on that have talked about meditation and breath work and like the Wim Hof and stuff. And I always, but I'm going to play a little bit of devil's advocate here because I was the person that's going to be listening to this. And I was thinking that seems very complicated. Seems there's a lot of moving parts. It seems very impossible to do. We all hear the fake stories of you start meditating, you levitate and stuff like that. But I was reading like some articles and stuff because obviously I wanted to learn what it was. Everybody's saying it's good for you. I had to at least try it. And I was surprised how easy it actually is. Like Phil Jackson wrote about it in his book, 11 Rings, that you could literally do it as you wake up in bed, just sit up a little bit, just do a little bit of breath work. So let's say like these people that are going to try and adapt this morning routine a little bit in their lives, where's the step one with meditation and breath work? Because I do agree with you. It was probably the biggest thing that would change someone's lives if they just started doing it in the morning.
Well, step one is your best resource is the internet, YouTube. You put exactly what you're looking for. 1 minute breath work, meditation, it'll pop up. And just follow along. If you don't want to do it, just listen to them. Just close your eyes and listen to them. Don't do the exercise. Just listen to them. Then the next day, listen to them again. And all of a sudden, I don't know, through osmosis or something, you'll start doing those exercises. Don't force yourself when it comes to these things right now. Just accept it, educate yourself. Just think about why you ever hear that story about like when coaches say, you know, 90% is mental, 90% is mental. You go out there and it's mental, right? During the game. Because it's all about that mental set. If you don't have that mind, your body's not going to respond. It's going to follow and dictate exactly what the brain is going to do. So if you set yourself off in the beginning of the day with a bad either news or something, well, that's going to be your determination of the rest of the day. Everything you're going to look at goes, oh, I'm anti this. Oh, this guy. Where if you listen to something positive and the same event happened, goes, well, I can understand that, or you can see the positive side of that. So you have to start off that way. So that's why I use the two ingredients that I love, meditation and a positive, a video positive. You can just type up on YouTube exactly what you'll look at. And if you're not that athlete, you're just like let's say you're just like an easy walker, just type that positive motivation walking and it'll pop up and they'll have people talk about, well, walking in a positive light. And it just makes things easier. I mean, luckily I have that mindset that I'm always positive. I don't know, because I have a bad childhood or something like that weird happened to me that, I forget the past. I always remember the positive. So I'm like thinking like, oh, it's always great here. So I don't remember anything when it comes to the past. So I think it just puts me in a better mood and I just push myself forward.
Probably. So there's a big part of morning routines at the minute, which again could be performative. I don't know, but seems to be cold exposure early in the morning. And I know there's this we've already mentioned ice baths, things like this here is like, and I know the benefits of it. That's the thing. Like I have mocked the ice bath community for a long time, but it's because of the way they speak. But I do know it does have a lot of benefits. But the problem is, like, if someone's getting up in the morning to go to work, they don't really have time to go and layer out an ice bath and jump in it and hold their breath and sing songs while they're in there. Like, is there a form of cold exposure that people could do in the mornings that's a little bit quicker, that maybe, and again in the evenings when they come back, they could do the ice bath, something that could just activate those benefits early enough so that through the day they can see the stagnant of energy?
Yeah. Yeah. The biggest thing is cold showers. You can take a cold shower. If you don't have that facility or the luxury to have that type of like, a tub, take a cold shower. Here's the thing about cold plunge or cryotherapy. If you guys, I know some of you guys have been through it, you know what it feels like, and some of you don't. It's basically you're pretty much torturing your body, right? You get into some cold environment, torture your body, and that's why you start hyperventilating. So it goes on to the world of autonomic nervous system. So when you get through a cold plunge or a cold shower, you just feel like your heart's racing. You just want to run. Well, you're going through a thing called a sympathetic reaction. You got that what they call the fight or flight. So when in that world, you're taking this kind of like this cold environment and you're trying to warm your body up. When your body doesn't sense it's warming up, it goes through that process of like shunting all the blood from your arms and legs to the core. It's trying to survive it. So because of that, you start shivering and stuff like that. But because of that vasoconstriction of all your legs and arms, it basically shoves the blood to the core. Now, the therapy and the results are not really during the process afterwards, because when you come out and the body senses, all right, we're back to room temperature, it does the opposite, which is the parasympathetic. When you go to the parasympathetic, your vessels open up large. So now you get the quick flush of the oxygenated blood down to the legs, but also the venous and the lymphatic system opens up too. So you get all that metabolic waste out too. So it flushes good and bad. So the quick return back. So that's why it's beneficial when you feel like, I feel like it's still, the effects are still there because you got the vasodilation, the parasympathetic. You're in a safe environment. So now you're relaxed. You're having a good feel. And that's what everybody wants to achieve, that parasympathetic, that relaxation feeling. So that's why it's good to have that protocol. But some people don't need it. Some people do. So it all depends on how you want to dictate your life.
There's one last thing on this morning routine, because this is a common thing I hear in my personal life, but I see it a lot on social media, that people complain takes them a little while for their muscles to get going or their brain to get firing a little bit. But I always think that this probably is stemming from how they wake up, because some people, that I'm victim of this a lot too, just roll out of bed and go on the day. That's it. There's nothing in between. There's no prep work. Is there any kind of movement or small exercises or any kind of adjustments we can make so that when we wake up, our body's getting there a little bit quicker? Maybe not firing straight out the gates, but it's not as long of a warm up period.
If I were to use that, that question on myself, I have to do my prep work, right? So that's the mental side of it. And then I prepare that. And because I have arthritis in my body that I have to deal with, I have to warm it up with dynamic stretches. So I'll do, like, let's say low back is a classic thing. Everybody has some type of low back. And then when you're at my age at 58, being physical when you're younger and you're here now, low back is something that you have to be concerned about. So I would do all these things called cat and cow, these yoga things. It's about dynamic, they call it like dynamic stretches before you do the exercises. Then you do your exercise and you call it into a static stretch. So the dynamic thing is that you're just trying to mimic your daily activity. If you have problems when you get out of bed and your knees ache, well, before you get out of bed, just sit on the side of the bed and do knee extensions. Just let your feet hang and then extend your knee back and forth. Try to get maybe 50 to 100 reps. It's not that hard because it's your body weight, and then it warms it up. When you warm it up, you increase that type of like synovial fluid, loosens the blood up in there, so then it gets into the tendons and ligaments, and then you're able to do those things. So it's about finding out what exactly you're dealing with and then warming that part of that body up in that sense of dynamic stretches.
Let's finish this up with some mythbusters, because I believe me, the amount of like myths people send me to like get busted on the show with, like PTs or health professionals or coaches or even athletes that come on, it's insane. And I can never really ask them because it's a little bit of a grey zone, but you're the man that I think I could ask these two and we'll get them sorted. So first one is, you need to eat 30 minutes after working out or you lose all your gains.
I don't know about that. That one is interesting. I like that. I like it. It's a good shot, but 30 minutes, I mean, you definitely need to replenish. You have to replenish. If it's hydration, electrolytes, you have to replenish, and that's absolutely true. You can do that. But as far as eating to get your gains, there is some information on that. Of course, you break down muscle tissue from a workout, and what you want to do is recover, and you want to build that to be bigger, stronger, faster, right? So you want that. So you have to have the building blocks, and that's a form of proteins, amino acids. So you have to have enough of that to build that up. So there's some truth to that. But as far as a time frame, I don't know about that time frame. Maybe it's some type of habit that you want to continue on, but I don't think 30 minutes. But you do have to have some type of food if you want to have that gains or that building blocks back in your body.
Well, what about the people then that are jumping on this trend of intermittent fasting? They maybe train in the mornings and then they don't eat till later in the evenings. How's that working for them? Because I've seen a lot of people, and I know a lot of people personally, that have had really, really good results doing that. The delaying food for as long as possible, but still working out at normal times.
They have a good storage pack. You can store a lot of you can store a lot of protein or fat or energy in all kinds of format, right? So we store a lot in our liver and our fat adipose tissue. So that could be, once your body creates a behavior, it knows the next step. So if you're that person that needs to like eat right after your workout because that's your behavior in the past, well, you're gonna have the same outcome if somebody's gonna fast. The thing about fasting is that I fast. I do intermittent fasting. Mine is because not so much of like performance. It's because it's behavior. It's just something that I condition myself because I'm kind of like, I like to waste my time in a meditation and a me time when I tune in and I want all fire, all my cylinders firing correctly. And I don't want to waste it with food or eating or cooking or prepping. I'd rather just do that. So mine's out of necessity and it became a behavior. And then all of a sudden here, it's just part of my lifestyle. So it all depends. There's some truth behind that, but you have to look at their age too. In my age, you have to remember that once we start getting older, we start losing that signal, right? The signal to regenerate, to heal faster. So you have to be cognizant of like time to go back into a workout and how to recover. So once you really understand your part of your life, where you're at, if it's, like late 50s, early 20s, well, when you got that young age, it's almost like you can fast for 7 days and you'll still get some type of gain because you just got that kind of like that you still got those growth factors that just run through your body. But when you're at this age, you got to be careful. You got to make sure you got your timing right.
The second one is, carbs are the enemy of fat loss.
Carbs are a great energy source. It is a great energy source. No doubt about that. So if you want to look at carbs, carbs is like, you know, you eat carbs, one step, you get this thing called amylase and it breaks it down to glucose and boom, you got energy, right? And if you got excess energy, it turns into some type of like stored energy in the liver or the adipose or the fat tissue. So there is some thought behind, getting energy instead of having it from a carb. You can get it into a maybe a protein or fat. You can get that way. So fat loss, you just got to be careful. You got to be methodical of how you lose fat. You don't want to lose because if you lose fat too fast, or let's say you don't have energy, that's sugar, right? So then when you start exercising, it's some kind of gasoline, that's sugar. It needs that glucose, right? So it can break it down in a fat type of form, but it's going to be in a slow process. Or if you're going too fast and you're exercising, well, it's going to take it to the easier source, which is the muscle. So you break down muscle instead of fat. So you have to be careful how you go in that road of like no carbs with exercise.
Protein shakes are essential for muscle recovery.
I think protein shake is very simple. It's very easy. It's very simple and it's like no big deal. Instead of like getting in front of a kitchen and cooking yourself a chicken or a steak, protein's protein. I look at it. I don't look at the complexity right now. I just look for the general, like the macros, right? Protein, fat, sugar. I mean, protein, fat, and fat. Protein,
Carbs.
fat, and carbs. Jeez, I forgot those three guys. Anyways, I so when I think about like protein shakes, yeah, I mean protein shakes not gonna, it's just like a cheat code of cooking. So if you want to have that, no big deal. Just be careful how much protein you take in. So you take too much protein, it puts too much stress on your kidneys. So that's why you have to dilute it with water. So make sure you drink enough water when you're taking that high numbers. Like if you get to numbers like 500 grams of protein, you hear guys taking it. I mean, be careful. That's too much protein.
I wish I had the name of the guy that wrote this because he wrote this as I wrote this down. Inflammation is bad.
Inflammation is bad, especially when you call chronic inflammation. You don't want, so basically your body responds to an injury in a mechanism. It has to inflame the area. It makes like a natural cast, and it also brings in all these these guys, these macrophages that chew up the bad stuff, and then brings in like information or building blocks to heal the tissue. So, it's part of the healing process. But when you start talking about chronic inflammation, let's say you take a food that you're not allergic to, but you have sensitivity to. Well, your body thinks there's something going on. So it's going to do what this called like inflammatory world. It's trying to respond to something. So you hear about things like autoimmune, there's going to be some type of chronic inflammation, or when you have that, that sensitivity to something, or you're stressed out. When you're stressed out, you can have chronic inflammation. So inflammation starts doing that world of sympathetic. It starts like stiffening the arteries, kind of blocks in that kind of like that mechanism to help heal tissue. And then you don't function correctly. So inflammation is bad when you look at just the chronic. But for acute stuff, it's just part of the process. So inflammation in a chronic way is bad.
Dynamic stretching is better than static stretching.
Yes and yes. So yes, yeah, dynamic stretch is good for the beginning of a workout. So for instance, like let's say you do squats. So you want to mimic the movement of squats just to warm up that mechanism, that pattern that you want to go. So dynamic stretches. So think about each joint, each, a muscle that you want to mimic that movement. So dynamic means you just basically no load and you just swing that ankle, knee, hip in that motion until you can feel that joint loosen up. Then you slowly load up. Then you start going with the body weight. Then add your 5, 10, 20, and then you finally get to the weight you want to start off with. That's your first weight. That's dynamic. Whereas static stretches is basically you just stand there and you hold a stretch for like 10 seconds, right? So they always say dynamic stretching before the workout to mimic that exercise, and afterwards to elongate that tissue so it doesn't shorten. So then your recovery is faster because you want to elongate that tissue. So dynamic it has its purposes. So is static.
I know this one's going to get on people's nerves, but everybody needs 7 to 8 hours sleep.
Yes, I think it's part of recovery. Now, here's the thing. Some people can get away with 6 hours sleep. Some people can get away with 4 hours sleep. It all depends on you and your coding and your genetics. It's all varies, right? Like for instance, like me, I feel great at 6 hours. I'm okay with 6 hours. Now, do I need to take a nap? That feels good too. So it all depends on your lifestyle. So I always think that you just have to listen to your body. If your body wakes up, wake up, But if you feel like it's affecting your kind of your thought process, you know right away your biofeedback of you not having that concentration because of lack of sleep, then you have a problem. So it all depends on your like overall view of how you're doing things. But don't cheat by saying I need to go 8 hours, so I can't do it. So I'm gonna take an Ambien or a sleeping pill, because now you're walking down the pharmaceutical route. Now you're changing your chemistry. Now you're doing things that you're gonna have to take something to wake you up because you went to sleep with this pill. Now you have to wake up. Now you're thinking about I need to do this, and then you have to be careful what you're doing, because every time you introduce your body to something to improve, you're going to have to do something to antagonize that if you want to do the opposite later down the day or that evening.
I mean, there's been gems left, right, and centre here, but we're going to wrap it up now because we can't give away too many health secrets. But Tommy, where can people find you? What have you got out and what's coming in the future?
Okay, you can go to my website and learn about topical stem cell, Regen, RHEEGEN.com. And you'll learn about stem cell therapy. And more importantly, there's a info button. Just hit that and ask me a question. And of course, I wrote a book, and the book really kind of explains the whole process of stem cell therapy, and then the present, procedures, and where the future is moving into. So you go to Amazon and go to, to the search bar, hit the future of regenerative medicine, type in my last name, RHEE, should pop up. And the neat thing about that book, it has, the scientific kind of like the version of it. So if you're that kind of analytical person that want to see the message, you want to see the enzymes, you want to see the whole process of this stem cell in the scientific version with cited sources, it's there. But there's also a journey of Jeff in the layman's term that talks, summarizes, but talks about how he discovered it, where he's at, and where the future at. So it's really is a good book for two people, that person, a scientific person, and somebody says, skip that. I just want to know the generic kind of thought behind this whole process. So you can take a look at that book.